have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab, we also strengthen our data collection.
All of our health centers offer antenatal services. So persons have access to the health centers, and once you go to a health center, we offer the service. And part of the packages is that you are supposed to have your HIV test done, your syphilis test done.
Before we implement the mother-to-child transmission was really in terms of encouraging patients, the need, and therefore the educational part of it, in letting them understand why it is important for us to do these tests and why should we repeat it.
Before implementation of the strategy, what we were seeing here in clinic is that patients, pregnant women, were coming very late in pregnancy for treatment, as in the antiretrovirals during pregnancy. So I can clearly say that we have seen a drop in the numbers of babies being born or being exposed to HIV because of the implementation of this strategy.
When we look at in terms of HIV testing, we've had a lot of training from our regional partners, PAHO and the Caribbean Medlab Foundation. What is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
for us, it was not just one-on-one in terms of sharing the information, building the capacity individually and collectively, but also the psychosocial services that were provided.
Well, I think the biggest achievement is really to get people to understand the importance of the issue.
The guidelines, the biggest thing with the guideline is that it helped to get everybody on board so that we're all following the same policies and the same protocol, so that we know that if a patient comes to me and this patient goes somewhere else, it is saying the same thing.
For me, what is important is sustainability. Not just as a Ministry of Health, but as a country to ensure that we continue to provide this very vital and appropriate services to the people of St. Vincent and the Granedines.
We just have to continue, keep focusing. We need to be more vigilant when it comes to surveillance and reach persons where they are, so we can continue and fight towards being a better country, being a more healthy nation.
I must say kudos to the persons who have worked over the years on HIV.
I think the team in health is phenomenal. And I think that if we step back a bit and look at what we have been able to achieve, we would appreciate the strength we have. All of these accomplishments were done as teams. We were able to work together. Congrats to St. Vincent and Grenadines, the primary health care, the public health system.